Have you ever wondered what's really going on beneath the surface of your gums? Periodontal disease is a sneaky condition that can cause serious damage to your teeth and your overall health. In this video, we will delve deep into the world of periodontal disease, explore its causes, symptoms, and treatment options. Periodontal disease, also known as gum disease, is an inflammation and infection of the tissues that support the teeth. Poor oral hygiene can bring about this condition, but some people are just prone to this condition more than others, even with proper brushing and flossing. Symptoms of periodontal disease or gum disease include reddish or purplish gums, soreness, bleeding, bad breath, or what we medically call halitosis. You may have pain when chewing, gum recession, that is gums that pull away from the teeth, and then you may have a change in the way your teeth fit together. Healthy gums are firm to touch, they don't bleed or swell, but periodontal disease can cause discolored, swollen, or bleeding gums. Left untreated, periodontal disease can cause destruction of the underlying jawbone, leading to a possible tooth loss. Periodontal disease happens in stages, and the breakdown of tissues around the teeth happen gradually. In fact, most people don't really feel pain during the early stages of the disease, and that is why it is important for you to know the warning signs. There are 4 stages involved in the periodontal disease, and the first is gingivitis. This is the earliest stage of the disease, and it may start with a red, puffy gums that may bleed when you brush or floss. There is no bone loss here, and as a result, it's totally reversible with proper treatment. Second, we have mild periodontitis. Here, the bacteria have seeped beneath the gums, affecting the supporting bone. The gums may pull away from the teeth, creating pockets around them. And plaque and bacteria like to hide in these pockets where toothbrushes and floss can't reach. The third stage is moderate periodontitis. Here, if it's left untreated, bacteria begin to erode the ligaments, soft tissues, and bone that hold the teeth in place. You may notice bad breath, or you may also see a pus formation around the gums, and some people may develop pain at this stage. The fourth and the last stage is advanced periodontitis. Here, the disease worsens, the bone loss continues, and may cause the teeth to become more loose and may eventually fall out. Gum disease is reversible if treated early enough, but if you've lost bone around the teeth already due to infection, then the disease is too advanced to reverse. However, you can manage it with proper treatment and consistent, diligent oral hygiene. Now let's talk about the causes of periodontal or gum disease. The buildup of plaque or dental plaque is the number 1 cause of periodontal disease. The plaque actually contains different kinds of bacteria that can potentially infect the gums. And that is why you are more likely to get a gum disease or periodontal disease if you have poor oral hygiene. In some people too, genes play a role in gum disease by changing the way their immune system responds to bacteria. What are the risk factors? A risk factor is something that increases your chance of getting an infection, a disease, or a condition. The risk factors are 1, if you have diabetes, if you smoke, if you have poor oral hygiene, stress, genetics, if you have a heart disease or an autoimmune disease, and hormonal changes during puberty, pregnancy, and menopause. Is gum disease or periodontal disease contagious? The bacteria that cause gum disease can pass from person to person. And that is why it is important for you to know that while a brief casual contact cannot actually let you catch the infection, repeated long-term contact through saliva can actually get you at a higher risk for the infection. Are there complications? Yes. Unless you get treatment for gum disease, it continues to worsen, wreaking havoc on your oral health. Research has also shown that there's a direct impact of gum disease on our overall health and well-being, and that there's a link between gum disease and other health issues such as heart disease, stroke, or diabetes. Gum disease isn't curable, but it is manageable with proper or appropriate treatment. There are a lot of treatment options available, and the one that's right for you depends on the severity of your condition. The treatments include dental cleaning and oral hygiene improvement, scaling and root planing, pocket reduction surgery, bone grafting, gum grafting, laser-assisted new attachment procedure, guided tissue regeneration, etc. In most cases, you can prevent gum disease with proper oral hygiene. Some people are more prone to gum disease due to genetics and other health conditions. In these cases, more frequent visits to the dental hygienist for more cleanings is very important. Now let's get to know 5 tips to lower your risk for gum disease. Number 1, you brush your teeth 2 to 3 times daily. You floss between the teeth at least daily. You employ the use of an antibacterial mouthwash. Avoid smoking and other tobacco use. And then you visit your dentist regularly for cleanings and examination. If you are concerned about your oral health or you suspect you may have a periodontal disease or a gum disease, don't hesitate to schedule an appointment with your dentist. Early detection and treatment can make all the difference. Remember, a healthy smile is just the beginning of a healthy body. This is Time with Nurse Joycelyn. Kindly subscribe to this channel for me, like and share my videos, and then put on your notification bells for new updates. I'll see you in my next video.